Today we have a unique webinar. We're going to talk about the required call recording elements. And some of you are probably thinking, well, what does that mean? That means we really haven't had much guidance on, well, let me start at the beginning of the presentation as well, I should add. We really haven't had much guidance on what, really none at all, on what should be in the actual call recording. So we're going to go over that today. So we will give you an idea of when you have a call and you record it, if you get audited, what CMS and the carriers are looking for in that recording. So that should be helpful. And now that you can hear me, it's probably even going to be more helpful. So, all right, so let's get started here. So we're going to talk about, our topics will be the lack of guidance for compliant recordings. It's been very vague, very little direction as to what you actually have to say on the recording. We're going to go over the requirements. These requirements that we're going to go over are based on recent audits that have been done with our partners and the feedback from the carriers when they audited the recordings, and they stated what they wanted in the calls. And when these recordings were audited, they said that there were a lot of things missing, and they laid out what should be in there. So that's what I'm going to go over with you today. Talk about the disclaimers. We're going to talk about clarification on when you actually need to record. That's been assumed by a lot of us based on what was written in the rules, but we have more clarification on that. And then we'll talk briefly about the additional rules in 2024 in the CMS proposal that they put on the Federal Register, and to a degree how it kind of contradicts with these recent audits and the feedback we got on that, but we'll kind of go with what we have and talk about that in a minute. A couple quick things I should have mentioned is we do record these webinars, so we will record these. So if you can't make future webinars, just register for it. And then when you register, you'll get the recording emailed to you. So you don't have to attend to get the recording. And then also we put all these recordings on YouTube. So you can go to YouTube at Crowe Medicare or just Google YouTube Crowe and Associates. Last thing, if you have questions, send them to the question box and I will try to answer them for you when we're done at the end. All right, so we know that we need to record when we're not face-to-face. That was pretty clear. No, we need to have the disclaimers on the recordings, but what other aspects of a sale needs to be recorded? So again, there's been little guidance on that. Really, people record calls, but we're really not always sure what we're required to say in there. So this should help with that. So as I mentioned, recently we had audits done with partners of the recordings, and this is the feedback we got from the carriers regarding what they want and what CMS wants covered in a call, and there's 5 key elements that we'll talk about. What's strange about this is the CMS proposal for 2024 addresses this issue and lays out what should be in a call recording, and it doesn't exactly match up with this recent guidance we received. In fact, it's less, so we'll see where that goes. Okay, if you want to see the proposed rules for 2024, I referenced those a couple times. We did a webinar on that. It's recorded. Go to YouTube at Crowe Medicare and you can watch it. And it's called New Medicare Marketing Rule Proposal for 2024. So let's get into the elements of the call. So these are the elements that are needed in a call recording to be compliant if you get audited. So the first piece is review the summary of benefits. So on that call, they want to see you review the summary of benefits of the plan with the consumer. You don't have to go into great detail by any means, but you have to mention the summary of benefits. And they did suggest that you should probably go through it with the person. They didn't say you had to, but they suggested you should. So go over the summary of benefits. Answer any additional questions asked by the prospect. So you've got to answer their questions. It seems pretty obvious, but that's what they put in there. Provide accurate information on plan details. So I guess that was a big issue. So be accurate with what you tell them about plan details. That's the first category. The second is read all the required disclosures for the determined plan of interest. In other words, just read the disclaimers. So we'll go over that, and I put that in the next slide. Okay, here's the disclaimer. If you haven't seen it before, I'm sure you have, but you're supposed to read this disclaimer within the first minute So when you record a call, you need on the recording to be you reading this disclaimer. You also have to inform them the call is being recorded. You can't forget that part. So if you have a system that automatically does that, like Connecture or Sunfire, that's great. If not, you have to mention it to them. And then one other thing that's kind of sort of related to all of this is when we're talking disclaimers, just remember this disclaimer has to go on your website. So if you have a website, the disclaimer has to be on there. It needs to be on all your marketing materials, email signatures, basically on anything you're using to solicit or to communicate. That disclaimer should be on there. The next category is to accurately complete the caller's application and review it. So things that we're missing that you need to put on there is provide the name of the plan. So you got to put the plan name that they're enrolling in. You have to advise them of the effective date. And then you have to confirm the beneficiary is ready to complete the enrollment. So get their acknowledgement that they want to enroll. Have them say, yes, I want to enroll. You have to provide a compliant call closing. So this is the next category. So provide carrier name and customer service phone number. All right, provide the TTY. I see that all the time. I'm sure many of you have before. I quite honestly never thought too much about it. But you're supposed to provide that, and that, what does the acronym actually stand for? Text, telephone, teletype, teletypewriter. TTY is the code 711, and that is obviously for people who are hearing impaired or are speech impaired, and their phone has to be set up for TTY. So if, you can't just do it on any general phone, but you need to provide to them that there's that information. And lastly, you have to provide the application confirmation number. So if you're doing these enrollments on like Connecture, Sunfire, My Medicare Bot, you have to provide confirmation number, the application con number to them. I put a section in here because they listed this. For those using Marks, most of us don't have access to Marks. Marks is usually available to a call center, but there's a limited version of it on Sunfire. So for those who accessed Marks, you would need to include this piece. For the majority of us, we don't have access to Marks. Sunfire, even though it is the Mark system, it is a limited version of it, so it's really not as applicable to us, but I'm going to go over it anyway. So the agent must obtain permission from the beneficiary to access Marks on their behalf and may provide details on the following. And what this comes from is, with the Mark system, you have to put in their Medicare ID. Same thing on Sunfire to access their information, and I think they found often that people were simply putting their Medicare ID in there and not letting the person know they were accessing their information. So it's a disclosure thing, making them aware that you're going in and looking up their current enrollment, because Marks and the limited Sunfire version will show what they're enrolled in currently, and it will show plan history as well. The real Mark system shows their full plan history forever. The Sunfire version, I think, shows 2 or 3 years back, so it's a bit limited. So provide details, let them, you got to tell them that you're looking up their current enrollment, that you looked up their Medicare A and B start dates, and if you looked up their eligibility information, which you probably did because it provides it, Marks does and Sunfire does, if they have status of help, maybe they're a dual, a QMB, a Slim B, whatever they may be, you have to make them aware that you're looking these things up. And as I mentioned, Sunfire provides a limited version of Marks. When you go in there, you need to have the beneficiary's Medicare ID. And if you have their Medicare ID in Sunfire, you can see a limited plan history, and I forgot, I apologize, it's either 2 or 3 years. You can see their eligibility status for, let's say, a dual plan, for instance, and you can see their A and B effective dates. Of course, you need a scope. You need a scope no matter what. Scope even if you don't close a case on them. So whether it's a call recording, because it's not face-to-face over the phone, in person, whatever it may be, get a scope every single time. Obviously, if you're on the phone, you're going to get an electronic scope, or you could do a voice scope. But regardless, you need one. And as I mentioned, you can get scopes via text, email, or you could do a verbal on Connecture, Sunfire, or Medicare Bot. Okay, so the CMS proposal that's on the Federal Register, and I talk about that on the webinar that's up on our YouTube channel. It states that they're going to clarify the recording requirements. One of the notable things in there is they're going to clarify when you actually need to record. So we had to make some assumptions there, but that's been clarified already a little bit, and they're going to just make it official with these proposals for 2024. But what it's going to confirm is the general consensus that we all had already, that you need to record when it's not face-to-face. You do not need to record if you're going to have a face-to-face meeting. That includes the effort to make the appointment. So appointment setting, meeting, and follow-up does not need to be recorded when you're doing a face-to-face meeting. They're going to just further solidify and confirm that. They're also going to provide further clarification on online meetings, and I think everybody knows at this point, online meetings are not considered face-to-face. I know in the beginning there were some carriers that said, well, a Zoom call is face-to-face. The CMS proposal is going to, I feel strongly it's going to say, it doesn't matter what kind of online meeting it is, Zoom, go to a meeting, whatever it may be, that is not considered face-to-face, so the entire thing needs to be recorded. So a little more when I mentioned the proposal for 2024, the proposal puts requirements on the call recording. So what we talked about today, the information that we learned carriers are looking for in an audit, CMS is going to address in 2024. And the things they mentioned is it puts basic requirements on the recording, and it says agents must explain what will happen to the current benefits. So interestingly enough, that's what they're saying they're going to have for requirement, but that wasn't one of the things that was required on the current audit. So I'm not sure. I think it always makes sense anyway. I think most of us would tell people what's going to happen to their current benefits if we enroll them. But it did point that out. And then it's going to provide a specific list of benefits and other topics that need to be covered. So it'll be official, but what we've learned is it's probably going to look very similar to what we talked about. That what they're asking for now will probably be what they're proposing for 2024. As I said, how different will it be? I don't think it'll be very different, but I don't know that for sure. Okay, that was it for the call recording piece. I'm going to talk about a couple other quick things that I just want to point out that we get asked at the office quite often. So one of them is OEP. Believe it or not, I know this sounds super basic, but we get a lot of people confusing what you can and can't do during OEP, so I just wanted to point that out. During OEP, you can only do two things using the OEP election, of which we only have a few days left because it ends in March. But what you can do is you can move from one Advantage plan to another, and you can move from an Advantage plan back to original Medicare, a supplement, and drug plan. Those are the two things you can do. You can't do anything else. If you're Medicare only, you can't add a plan. You can't move from an MA to a PDP. You can't move from original Medicare, supplement, and drug plan to an MA. It's only these two things that you can do during the OEP. And keep in mind, if somebody's doing the option of moving from an MA back to original Medicare, a supplement, and drug plan, if you're in a supplement underwriting state, which is most of them except for 4 of them, if you're in an underwritten state, that supplement is still going to be subject to underwriting. Another thing I want to point out is we see a lot of these is the delayed Part B enrollment. And it's confusing. So, and I in the past had screwed this up myself a few times. So if somebody has a delayed Part B enrollment and you're going to use their new to Medicare election, because for an Advantage plan, you've got to have A and B. But if they're delayed B enrollment, so they didn't enroll in B at the normal time when they turned 65, they had a valid waiver and waived it for maybe a year or 2 or 3 or 4. If they do a delayed B enrollment, the new to Medicare election, you have to enroll them, submit the application prior to the B effective date. We often will think they have 3 months or 60 days they can get that in, but if it was a delayed B, that app must go in prior to the B start date. So just remember that. It's easy to confuse. If that's not the case, maybe you meet somebody who's delayed B enrollment and they enrolled in B in May for a May 1st effective, and they're talking to you on May 15th. You can't use that new to Medicare election for them, but hopefully if they had lost employer coverage, which assuming in this scenario they probably did, then you could use the lost employer coverage SEP because you have 60 days with that, 60 days after the loss of coverage. So just wanted to clarify those two things. A couple additional things. Our educational seminars have been working very well. It's been our most productive program in the last 12 months. We can do them in all 50 states, and you can run those year-round. If you aren't interested in seminars, if you don't like to present, then you shouldn't put the time and effort into it. But if you do like to present, our program will put people on average about 50 or more in front of you, T5s. So it's a great program. It's turnkey. We've got all the best practices for it. Just give us a call and we can tell you how you can get started with it. We have a recorded webinar for those who want to learn about how to do Facebook ads. I know that's a big thing. We have some agents in fact have bought Facebook ads through a third party. Quite frankly, they don't close at a high enough percentage to make it worth it, mathematically worth it, from a money standpoint when you buy them through a third party. Because through a third party, somebody generating them for you, it's going to cost 15, 18, 20 bucks a lead. The math just doesn't work well. But if somebody wants to go through the time and effort to self-gen Facebook leads, that does work. You learn how to access the system, how to get set up, and you learn how to run your own ads. It does take some doing. It's not going to happen overnight. But if you do that, your price point then using paid ads and doing this yourself, you can get Facebook leads for around $4 to $5 a piece, and that math will work. So we have a program for this. It does cost money, but we have a program for this. It's a one-time cost. You can enroll in, and it will give you instructions, detailed instructions on how to get set up and how to do this. It's great, because you can run leads for cheap, but what I would recommend is this has got to be something you have time for and that you want to put energy into, because it takes a little while to learn it, even with the instructional course. But if you want to learn it, you can, is my point. Anyway, we have a webinar we did on that recently. Same thing, just go on the YouTube channel and you can see the recording. I think my last thing I put on here is National Care Dental by MetLife. If you haven't looked into that, that is now approved in Connecticut and New York. They are having some delays with getting it on the quote site. I think it's going to be there, they said, in the next day or two, but it's approved. And it's a great network. If you haven't looked at the standalone dental, the MetLife network, it's their employer PPO network. So it's a great product, because that's usually the issue with dental plans, is the network sucks. MetLife's is a really good one. So it's a standalone dental plan, good price point, huge network, and high commissions. So that's something, we have that contract available, great comp, and it's available in a lot of states, including Connecticut and New York. Well, that's it. That's all I have. Sorry for the mess up there in the beginning with the not being able to hear me. Again, you can watch the recordings on YouTube. We're going to do a Zoom meeting tomorrow for those interested on a variety of topics. A couple of them we're going to do is commission payment details, and I'm going to go over a lot of the ways that currently that agents are using to generate Medicare leads. So lead programs and different strategies successful agents are using to generate Medicare leads. We'll also talk about referrals, when getting referrals and paying other professionals and other organizations, how you can do that compliantly and how you can make it work. So it's a Zoom meeting tomorrow at 1 o'clock. The invites for those already went out. If you didn't get it and you want to attend, feel free to just call us or email us and we can get that out to you. Let's see if we have any questions other than why you can't hear me. Let me try to take a look here and see what we got. Okay, so let's see. Has the webinar begun? Yes, I'm sorry. I was talking, you just couldn't hear me. A bunch of people said they could hear me now. Let me get through all those. Okay, a question. Do the regulations we were just talking about apply to med sups as well as MA? No. Great question. Call recording only applies to Medicare Advantage and PDP, and the reason for that is because Medicare supplements are not regulated by CMS. Not a CMS regulated product. So those rules we were talking about do not apply to Medicare supplements. So next question was, how is this handled if a person logs into our website, if they do enroll and follow up and record? No, if somebody, great question. So the question is, if somebody goes on your Pearl, like maybe you've got a website with your, connected to a Pearl for Connect Your Sunfire or Medicare bot, and they self-enroll, you don't record self-enroll. If you didn't talk to them, you don't need to record it. That's called a self-enrollment, and that's fine. No recording requirement there. Good question. Let's see what our next one is. Okay, let's see. So we have, next question is, for those prospects that are local, Can we, without recording them, tell them we only do face-to-face and make the in-person appointment? Yes. Yeah. So to answer your question, yes. If your intention is to meet with them face-to-face and ultimately you do, then you do not need to record that call. So you certainly could tell them that, yes. What else do we have? Questions from a few potential downline agents, and I don't have the answer. What are the call requirements for an agent enrolling themselves, a spouse, a parent, the same as any other client? So I guess what you're saying, if somebody's an insurance agent and they're recording themselves, what's the requirement? Well, technically the answer would be if they're enrolling themselves, they're face-to-face with themselves. So I don't think you'd get in trouble on that one. So if they're enrolling themselves, you don't need to do the recording. I might be reading that question wrong, and I apologize if I am. If I am, then just give us a call or something, and I'll clarify. Okay, please clarify not being able to enroll in Part C plan past the effective date of B. Okay, so again, to go back to that, delayed Part B enrollment. If somebody's turning 65 and they get on Medicare A and B, then no problem. They've got 3 months before, the month of, and 3 months after to enroll in an Advantage plan, if we're talking Advantage. But let's say somebody enrolled in A in 2001, but they're actively working, so they delayed Part B enrollment. They didn't need Part B. And let's say in March of 2023, they enrolled in Part B, and they call you at the middle of March and say, hey, I just got Part B. I want an Advantage plan. Well, your initial tendency may be to say, well, they're new to B. You got to have B to have an Advantage plan, so they're new to Medicare. And they are. But that election for delayed Part B enrollment, you have to enroll them using that delayed Part B election, new to Medicare. It's got to be, the app has to be put in before the B effective date. So in that case, if they call you 15 days after the effective date, you can't use the new to Medicare election on them. Hopefully they had group coverage they lost, and you can use the SEP for lost group coverage. Hopefully that clarifies it for you. Is the new MetLife dental program fairly cost competitive in your opinion? Yes. Yes, it is. I believe it is. I think if you look at it and compare it, it is pretty cost effective, yeah. Somebody sent me a question about MedSups being regulated under a different Medicare Part E. No, MedSups aren't regulated by CMS. They are regulated by states, by insurance departments. But we can talk. If you have questions, send that in to me. Somebody said, what if a member calls with questions? Well, if they're a current member and they call with questions and you're not going to enroll them, I think the reg says you're supposed to record everything, but my opinion is if there's not an enrollment and they're a current member of yours, you don't need to record. I probably wouldn't in that scenario, but if you want to be completely doing exactly what it says, and again, it's a little vague, technically you should record that. Okay, let's see what else we have. A lot of questions today. Good, I'm glad. I'd like to get the questions answered. Do any of the enrollment tools contain scripting which would satisfy all of the key areas CMS is requiring? Yeah, the one that does that is My Medicare Bot. My Medicare Bot has scripting built into it, so when you're on the call with somebody, it scripts the entire call for you. Okay, next question. Do you have to say the disclaimer every time you speak to someone that is recorded? Yes, quick and easy. Now, here's the thing. If you talk to somebody and recorded it, read the disclaimer, and then you talk, but you didn't enroll them, and then later on you talk to that same person again, you don't have to read the disclaimer again because you already have it recorded that you said it to them. You have to record it. So let's say you meet with them, talk to them, they don't enroll, something goes wrong, whatever, and you read the disclaimer and recorded it. Then the next time they call, you still have to record it, but you don't have to read the disclaimer again because you already read it to them and recorded it. Somebody said, it sounds like a field agent doesn't need to record setting appointments. Correct. If you're a field agent and you're setting up face-to-face appointments, you don't need to record them. Somebody said, is delayed Part B different rules for MAPD versus PDP? Yes. That's a really good question. So delayed Part B for an MAPD versus a PDP is very different. The reason is a delayed Part B enrollment is not an election for a PDP. Believe it or not, you're eligible for a PDP with Medicare A only. And I've had that happen to me as well. I've done about everything wrong, Brian. I have had somebody get Part B delayed, and they want a PDP, and I try to put that in for an election. It is not an election because they're eligible for a PDP with A only. So in that regard, yes, they are different. Good question, though. Good thing to point out. Okay, if we do the enrollment online but in person, do we have to record anything? No. If you're enrolling them online but they are there with you, that is a face-to-face. You do not need to record. Okay. Somebody said, for Part C enrollment, if within the 7-month window for IEP, yes. You have 7 months. If for a Medicare Advantage plan, you have 7 months to enroll people if they're turning 65, new to Medicare. They have the 3 months before, the month of, and the 3 months after. Absolutely. The question is, can the member who has MetLife Dental switch plans ongoing? I'm not sure I follow that. Do you mean switch from their current dental to MetLife, or switch in within the MetLife plans? MetLife's definitely going to put limitations on the time frames they can switch internally in the 3 different MetLife plans. Not quite positive on that question, so sorry maybe I didn't answer what you were looking for. Do you think Sunfire and Connector will also soon have scripting? I do not know. That's a great question. I do not know. My Medicare bot certainly does, because my Medicare bot is set up truly for voice enrollment versus Connector and Sunfire. They're set up for phone enrollment, but ultimately you're sending that enrollment link via text or email to the person. I do not know. I assume they probably will, but when and what they'll have on there, I do not know at this point. Do you have any idea how the let me click on the whole thing here. Next question. Do you have any idea how the 48-hour scope of appointment requirement will affect the enrollment tools? I don't yet know exactly, but I don't think it will change them much at all. I think just when you go in the enrollment tool, if you want to enroll them through that, you will send them the scope initially. That will have to be sent 48 hours before, and then you will do the enrollment 48 hours later. So you can still send them the scope through those systems, but that's time stamped. So that scope's going to have to be sent online, signed, and then it's going to have to be 48 hours before you can enroll that person. Somebody said, if I do a Zoom meeting but client is also with me physically, do I have to record? Oh, you blew my mind on that one. Why would you be doing a Zoom if they're there with you physically? Maybe you're joking with me. I don't know. Clarify that question for me, sir, if you don't mind. All right, they were joking. I'm being a dope and naive. My fault. Funny. Will a Zoom meeting be considered face-to-face? No. No online meeting will be considered face-to-face. In fact, most of the carriers right now don't consider online meetings face-to-face, but CMS is going to solidify that and actually, provide detail on that no, Zoom, GoToMeeting, those things aren't considered face-to-face meetings. All right, I think that's the end of the questions. If anybody wants to ask me an obvious one as a joke, maybe I'll be too stupid to know that and read it. We have another question. I think this is a real one. If you are getting initial information from people like date of birth, doctor, etc., do you need to have the scope of appointment completed? Well, to answer that question, if you are talking to them about Medicare and Medicare Advantage or PDP plans, then yes, you would need to complete a scope, is your answer. So if you're asking for date of birth, doctors, etc., I'm assuming you've talked to them about Advantage plans and a scope is needed. Let's see. We got a couple more here. Okay. Scope is needed for face-to-face meeting and telephone meetings, yes. Yeah, you always need a scope no matter what. I don't care what it is. It's face-to-face, phone, going on a take them on, you meet them on a cruise ship, you need a scope if you're going to talk to them about Advantage or Part D. Somebody asked, what about a client who can hear but not speak? Well, that is a interesting question. I've never run across that one. I'm sure it is out there. My assumption would be if they can hear, they would have some way to communicate with you, and if they sign the application and are of sound mind, then I think you'd be okay there. Next question: Can we still get a scope of appointment at the time of the appointment? Yes, as of today, you certainly can. You meet with somebody, get a scope, do the app, all set. That's what CMS is proposing. Is that they're proposing they go back to the 48-hour rule where you got to get the scope 48 hours ahead of the time you write them, and they're going to say there's no exceptions to that, is what they're saying. But yeah, as we sit here today on this webinar where I was talking to people that couldn't hear me for 5 minutes, sure, you can get the scope at the same time. So, thank you. Somebody said I had a client that couldn't speak. She had an app on her phone that she typed into and played audio. Very good. Thank you. I appreciate the help on that one. I really didn't know on that one. So thank you for providing that information. All right. It looks like a lot of good questions today. It looks like that's all we have for questions. I appreciate you guys coming on. Thank you very much. Feel free to join us for the Zoom meeting tomorrow if you would like. And other than that, I hope everybody has a wonderful day. Thank you.